I suspect that we are probably live. And the reason is that normally when I run these events, you have a broadcast button which you switch on when you, yeah. So I'm streaming live into YouTube at the moment. And what I need to do is to just bear with me a second. Yeah, so I have disabled the YouTube. Are we still there? Yeah. Okay. Oh, so we are live on YouTube, which is also useful for making a recording of the event. We have a couple of minutes before the start time. Number of participants is growing, but I'm going to wait until we actually get just slightly past 3 o'clock before we start. And then I'll welcome everyone. Also bear with me, I will just get my PowerPoint slide ready. Good. Normally when I do these events, I'm not acting as a moderator. I'm sitting in the background, spotlighting videos and having somebody else to moderate. So just as a little discipline to remind everybody, when you're not talking, if you're going to be giving any background noise, just simply mute your mic. So we've got a minute or so before we start. So I am making it that we are dead on the start time. I'll just give a few seconds for more people to join, and they won't miss a lot because I'm just going to do a few introductions and put up a welcome screen to begin with. Okay, so if you guys are ready, is everybody ready? Give me a thumbs up sign for say you're okay. Okay, good to go. Okay. Thank you very much for joining this webinar this afternoon on digital therapeutics. We're going to be looking at the impact of COVID-19 on physical and mental health. So we're going to be concentrating on those solutions which help people who are not directly suffering from the COVID-19 virus, but will be suffering some kind of physical and mental health problem as a result of the lockdown and social isolation measures. Now we've got a stellar set of panelists, and I'm going to introduce them in a short second. But before that, I just want to just welcome you to this session and just explain to you what we are planning to do today. Well, I put this banner up onto LinkedIn this morning with a headline that says, "Is the cure worse than the disease?" One of the things that I'm going to be asking to people to contemplate is whether the social isolation measures, etc., being put into place are actually going to exacerbate the problems of the virus itself. So this is the basic webinar agenda. We're going to be looking at, through the panelists, the lockdown and isolation measures in a range of different countries in which our expert panelists are based. We're going to be talking about the impact of these measures on physical and mental health. And then we're going to be talking about solutions which can mitigate the situation, beginning with solutions that support those who are particularly vulnerable and may have existing medical conditions, before we move on to those kind of digital technologies that can generally help with physical and mental health in the healthy population, people who are currently in lockdown, for example, or in social isolation. And I know Todd has some very insightful views on the phrase social isolation, but I'll leave him to talk about that later. We're going to talk about the impact of COVID-19 on the care workers and clinical staff before finishing up with how we can learn from these experiences. And as a little treat, I'm going to take everybody on a virtual tour to China and the Guizhou International General Hospital. So welcome everyone. Welcome to our panelists. Welcome to our participants. So I'm going to begin by asking each of our panelists just to say a little bit about who they are, what their company does basically, and what life is like in the country where they are living at the moment. So I'm going to begin with Shane. I'm going to spotlight her and ask her to unmute herself and tell us a little bit. So Shane, tell us about yourself.
Okay, I'm CEO of the LovexAir Foundation. It's a patient-led organization, and we're an umbrella organization for people with respiratory disease. We're based in Spain, but we're working globally, and we have a digital platform to help patients manage their disease.
Okay, so what is life like? You're in Portugal at the moment, but you have been in Germany, so you can talk about both of them. So
yeah,
start with Germany. What's life like in Germany at the moment?
It's pretty controlled, but it's freer than Spain and Portugal. The numbers are pretty well controlled on infections. The number of deaths is lower. There's more testing going on. However, from a personal point of view, I saw a lot of random behavior with people, even sadly in my own son-in-law's family. People don't seem to realize the consequences of controlling their movements. If they don't control their movements, what's going to happen to them, and infection. And unfortunately, as we all know, this spreads wildly, rapidly, and it's circumspect as to who is going to have a lethal effect of the virus if they are infected. So yes, it's complicated.
It's complicated. Okay. So now I'm going to go to Lucia and ask her to unmute herself. Lucia, you are based in Milano, which is a region in Italy which has been particularly hard hit. So tell us about yourself.
Yes. Hello, David. Hello, everyone. I'm Lucia Pannese. I'm the CEO of a company called Imaginary. We're based in Milano, right in the middle of the pandemic here in Italy. And we're specialized in serious games and gamification, mainly in the healthcare area. And life here is really difficult. I had to close my company already 2 months ago because I have lots of stuff coming with these trains from the outskirts. And it's quite controlled. Everybody needs a certification to go out to justify why they're out. So there's lots of controls, there's lots of fines, because as Shane said, several people just don't realize that it's, for everybody's health that we're doing this and trying to reduce our movements. It's not easy. Very many people, I think, are a bit depressed, but what should you do?
Okay, thank you for that, Lucia. We're now going to go all the way over to China and speak to Professor Jerry Sun. Jerry, what is life like in China? You were the first country to be hit by coronavirus. Are things getting better there?
Yeah, actually, China is not the first country to suffer the COVID-19 disease, but we have not have patients 2 months ago, but with the effort of everyone in our country, we control the disease. Now we reopen the market, the working. Everybody can go to the work as usual, except some few cities. For example, northeast cities. So we almost go back to work as normal.
Almost back to normal. Well, we wish we could say all say the same about our countries. Thank you very much for that, Jerry. I'm now going to move over to New York, the other side of the world, and speak to Leslie Robinson. So, Leslie, just say a few words about yourself.
Hi, everybody. Thank you for being here. I'm the founder and CEO of Transformation Games, a company that creates board games and card decks to bring people together all across all divides, transform lives and relationships through transparent and courageous and vulnerable conversations. I'm in New York City, so things are pretty chaotic in the United States, and depending on where you are, less or more so. Some states are starting to try to go back, even though they're not meeting even basic standards of safety. People are being really good in New York. They are social distancing. They're being very careful in the city. That's been very, very hard hit. So almost everybody knows somebody or has somebody in their family who's had the virus, who's passed from the virus. So you know, right now we don't really know what's going to be happening. Hopefully we'll be in China's position in days to come. Thank you.
Okay, so thank you for that, Leslie. So finally, Todd, I know you are you're making us all jealous with your seaside background, but you're not by the sea. Please tell us that.
No, this is my method of coping. So actually enjoying being on Zoom a lot. I live in Austin, Texas, and we do not have a beach here. Yeah, thank you. Thanks, David, and for inviting me to participate in this. It's quite an honor, and especially I'm really excited to learn from the other expert panelists. My name is Todd Maddox, and I am the Vice President of Research and Development at a company out of Los Angeles, California, called Applied VR. And the mission at Applied VR is to use immersive technologies, obviously virtual reality, for pain management, both acute and chronic pain management, as well as wellness and resilience. We have been on lockdown in the States, depending on what state you're in. Actually, some still aren't on lockdown. They live in fantasy land. But we've been on lockdown for quite a while. You know, to be honest, personally, it has not had a huge impact on me personally. I have grown children, not little children that I'm trying to educate. I've been remote for several years anyways, but I am itching to get out and do my outdoor activities like sweating a lot in the Grand Canyon and things like that, which unfortunately I'm not able to do right now. I have to say, I think I don't want to get too political, but I think the worst thing right now is just the lack of an organized federal response. As much as I feel for the folks in New York City, they have leadership there. And I actually enjoy watching their leaders talk about how they're responding to this. I think that and you know, I get cabin fever, I totally get it. I'm a psychologist, I understand that. But just because you can't see this contagion floating around you doesn't mean it's not there. So there's a lot of irresponsibility, and a lot of that's being fueled by, let's just say, nefarious people. So, you know, I think in a lot of parts, a lot of ways, the response or the lack of response from many people has been worse than the disease.
Okay. Yeah, thanks very much, Todd. I'm going to use the opportunity now at this point to bring up a polling question. And I'd like to ask all of you to give your opinion on which of the following COVID-19 related factors is likely to cause the most damage to public health overall. Is it the COVID-19 virus itself? Is it some of the measures like social distancing and isolation? Is it the fact that you're forced to stay at home? Is it going to be economic hardship and loss of income? Or is it going to be the loss of group activities such as the sports, football games, etc.? So I'm going to launch this poll and I'm going to ask you to select the one option that you think is going to cause the most damage. Okay, so I can see the answers coming in, and when we've got a sufficient percentage of people voted, I'll try and get at least 50% of people to vote before I share the results of those votes. So we're coming up, we're getting some interesting figures from this, okay. So I'm going to end the polling now because I've got a very tight schedule, and I'm going to share the results with everyone. So essentially, we have 3 factors which people have identified: the virus itself, the social distancing, isolation measures, staying at home doesn't get any votes, and economic hardship as being the, so we have 3, the COVID virus, social distancing and isolation, and economic hardship. I'm now going to launch another poll and ask the panelists and also the audience to vote on this question, which is to say, which do you think is likely to create the biggest problem for public health resources resulting as arising from COVID-19? Is it going to be physical health, illness or disease, etc.? Or is it going to be mental health issues? Which is going to give the biggest problem to our public health resources as we go through COVID-19? Okay, thank you very much for sharing those results. I will just share the results of the poll with you. We can see that we've got a 12-4 vote in favor of mental health. I know that we're going to be talking about that over the course of this webinar. So now I want to move on to the impact on physical and mental health, particularly on mental health issues. I'm going to start with you, Leslie, because you do a lot of work in this space. Just give me your thoughts on what you think the impact of these things, social isolation, etc., is going to have on mental health. How is it going to affect people?
Well, I think a lot of people don't really know how to process really difficult feelings by themselves. They have outlets, they have ways to release stress, they have socialization. When they're put back on themselves with loss, incredibly difficult situations, loss of income, they don't know how to process that. And many people don't have somebody to really talk to about it. So that gets, the internal state gets very chaotic, and it can get you into depressive states that can lead to drug addictions, different things. There's a big spike in domestic violence because people need that internal pressure to go somewhere, and it often, unfortunately, goes on people closest to them. So, you know, the poll's really interesting because a lot of people are passing, but then it's the families and people left with bearing the emotional weight, which I think is a big part of why people think mental health and depression is going to be more of a problem, that as well as what they're dealing with themselves.
Yeah, I think that's a very, very good answer. Todd, can I get your thoughts on this topic as well now, please?
Yeah, sure. So look, I'm a neuroscientist, and so I look at all these things from a neurobiological perspective. The stress and anxiety is well known to influence cognitive processing. So I think one of the first things that you're going to see, and we are seeing, is poor decision making. And I don't just mean, you know, rallies and you know, protests and all this. I mean literally just poor ability to make effective decisions because we have this low-grade stress. That's gonna affect healthcare providers. That's going to affect patients. That's going to affect family members. That's going to affect everybody. So basically, our ability to make effective, accurate decisions is reduced in this COVID environment. So that's one thing. So influencing the cognitive side, absolutely influencing the mental wellness and the mental health side. You know, we're not, yeah, we've got this pent up anxiety. We don't know how to deal with it. So you're seeing more domestic violence. You're seeing, you know, lots of these sort of negative ways of just sort of releasing. Personally, I mean, I think it's really heightened right now. But what I tell people is I think we've all got a mild PTSD, and I don't think that's going to go away anytime soon. So I thought the poll was really interesting. I picked mental health, but if I were to elaborate on that, I would say short run, it's the physical health. Right now, it's the hospitals that are overrun. It's the people that are sick. But long run, the mental health implications of this are not going to go away anytime soon. And frankly, for children who don't have fully developed prefrontal cortices and cognitive processing, the trauma of this will frankly be lifelong, and maybe to a lesser degree for those of us who are adults. But this is going to be around for a long time.
Oh, thank you for that answer, Todd. That's very insightful. Lucia, what are your thoughts on this?
Well, I also thought that this time span is something that we have to consider, because on the short term, it's definitely the virus, the main problem, as well as the physical problem. Because, for example, there's not only the patients from COVID-19 right now that we have to look at, but for example, as far as Italy is concerned, what I found out is that oncology patients are not getting their treatments. So it's much broader. Or neurology patients, of course, cannot go to day hospital. They are not training. They are just left behind. So it's even physical on a much broader base. And of course, that on the longer term will bring with it many more problems, which also go on the mental side. So yes, my answer would be it depends on how long we want to look at.
Okay, thank you. And Shane, what do you think?
I agree with the panel, but I think really we have an opportunity to change. I'm a very positive person. So I think that behavior change is vital now. In some ways, we've already achieved that, because everybody has been thrown into a new behavior because of isolation, because of social distancing. And what we need to do is really work with that at the moment and try and turn it into a positive track, rather than allowing it to fester and not adapting.
Yeah. Okay, thank you for that. Let's move on to Jerry, if we can get him spotlighted.
Okay.
My screen seems to have frozen, so I hope that is just a temporary.
Basically, I agree with you. I choose the physical health is most damaging because we treat patient in hospital, because I'm a physician. I think there are a little bit difference between Asia and the West, especially in China. We treat patient because the patient has some symptoms. If we can relieve the symptoms, they will feel better, much better. So in short term, the physical health is the most concern. Okay. David? Can you hear me, David?
David's frozen. I'm going to email him.
I think we lost our moderator.
Yeah. Does somebody want to? I'm going to email him and then.
It's just a live example that we have to learn coping with unprecedented things and sudden appearances and disappearances.
We do.
Somebody says he's working on it.
Okay.
He said he's worth it, but I'm sure he is.
Oh, okay.
I'm sure it's one of David's live experiments here to see what's happening in the meantime.
But one of the things that I noticed the difference between Asia and Europe is the behavior change was more easy to implement in an Asian society than in European society. I was in all the hotspots before COVID, let's say, became a media and people started to act in governance roles. And there was an inability of us to adapt our behavior change quickly. However, even in Southern European countries, that was achieved more quickly than Northern European. In England and Germany, people were very reluctant to change their behavior. I don't know how you feel about that, Lucia.
Well, yes, actually, it's true. I think in Asia, probably it's easier because people are more used to following the rules and the norms, and we are a bit more creative. Let's put it this way. But I was very surprised because, for example, even school stopped suddenly. There was some carnival holiday, and just after that, people or the students didn't go back to school. And in a week, everything was organized, which honestly, I would never have put my hand in the fire for, just to be honest. And everybody was just like, in a way, coping and finding solutions. And what I found was extremely extraordinary was suddenly everyone was trying to help and support as many people as they wanted, as they could. Being it from a technical point of view, just suggesting solutions or coping with solutions, but even what you said before, being positive. For example, lots of different trainers offering support, meditation, online events, just to bridge this gap of social isolation. That was extraordinary. Everyone who had some assets was really putting them for free immediately at everybody's disposal. And I think that was really what I like most, and what I think is really making a huge change into the whole story for everyone.
Yeah, I think so. And I think in spite of the political divides we've been living through over the last few years, which have been really excessive, globally, people coming together to help each other. I mean, the research, it's so phenomenal. The speed and acceleration of consortia coming together of researchers across the world, clinicians, all moving together in a positive direction. I think that is very motivating, actually, and I know that people are having an incredibly difficult time. Everybody knows people personally who are living like that, but overall, this is a period in our history, you know, and human beings do adapt quickly. We think that we don't anymore, but we do actually, if we look at ourselves anthropologically. Technology is a huge asset for all of us now. It's the asset, particularly in health. And finally, that message has got through, where in Europe, we were struggling so much with digital therapeutics to make it mainstream, you know. I think now that's changed the horizon and hopefully changing it for the better for the future.
Yeah, I have a couple of things to say on this topic. I mean, Shane, I'm an optimist too. My wife always gives me crap about that, actually, but I always try to see the silver lining. I think there's a lot of them. I mean, for one, let's walk away from the human being and let's look at the environment. The environment is taking a breath of fresh air right now. It's like, oh my goodness, you people who have been, you know, choking me to death are finally stopping, and I'm loving this, right? And that's going to be advantageous for all of us. So I think that's one point. And I agree with the, you know, taking greater advantage of the digital, you know, the digital therapeutics, telehealth, telemedicine. Are we going to replace one-on-one face-to-face therapy or visits with your MD? No, and we don't want to. But let's face it, with the fact that we're choking our world with pollution, the more that we can move away from that and become at least a little bit more remote, the better. And I think it, you know, unfortunately, it's taking a pandemic to lead to that behavior change and to, you know, relax some of the rules and regulations. For example, here in the States, with the FDA being much more open to the digital therapeutic solutions. So there's a lot of upside here. And I think the point I guess I would want to make is there's opportunity here for upside. Let's take advantage of it. Let's not go back to, you know, I hear people talk about the younger generation who say, we don't want to go back to the way it was. We want something new, right? And I think that's some of the opportunity that we have. So I'm with all of you that there's opportunity here and there is optimism.
Leslie, how do you feel about that?
Yeah, so I agree with you, and I think there's opportunity. I'm just, you know, being in New York City a little bit more pessimistic, although I am an optimist, because we had 9/11, everybody came together. It was beautiful, and then it went the opposite direction. People became more polarized than ever after that. This is lasting much longer. We're going to have to be adopting behavior changes. People are going to have to be adopting new things. The younger generation wants that. So I agree with you that there is reason for opportunity, but people are going to have to really step up to lead that. And hopefully, you know, some of the media can help leaders who want to usher in new changes to get some attention to bring this forth to the public, because that's a real challenge. If people don't know about people in the space who can help usher in greater opportunities for us all in so many different ways, but nobody knows about, nobody's able to hear their voice or know what they're offering, that's a problem. So, you know, there's a lot, I think there's a lot of levels that need to work on. I'm in a very different area than you, Shane. So, you know, you might have a very different perspective from what I'm saying.
No, and the other thing, I'm just looking at one of the questions to the panelists. What policy and behavior changes did you witness in the payer community for digital therapeutics within your countries? Well, I have to say, sadly, from Spain, there was very little take up of digital in general, and a lot of the organizations and providers with digital have just donated freely their services to support patients and healthcare workers. Now, actually, that's vital. It's a vital gesture, but it's not going to be a sustainable solution in the future. I mean, one of my concerns is the huge cost now on the healthcare services. In Southern Europe, we have a lot of public social healthcare services as the predominant care model. Are they going to be able to confront the cost of this as we move forward, and hopefully as this starts to recede? Will they take up digital in the same spirit that they've needed it so badly during this period of time? I think we have to keep advocating for this, you know, from our environments.
David is coming.
David, you need to unmute yourself. We were discussing the question from the attendees here about changes in behavior and payers communities.
Okay, thank you very much. I apologize for the interruption. My internet connection went down, and so I had to sprint or go very quickly from the barn outside back into the house and log on to my landline, which is not as good. So thank you very much for carrying on with your discussion. So where are we now? What have you been talking about?
We were just going over the question about policy and behavior changes from the payer community for digital therapeutics. I mentioned that in Spain, most of it was donated freely for the current burden. And we're hoping that are we going to see sustainable support for digital therapeutics moving forward in the future, particularly when we've got public social healthcare models, you know, in Southern Europe.
Yeah, okay. Have you talked about the solutions that are currently available for people with pre-existing conditions? Can we move on
Not
to
yet.
that topic now?
No.
Okay, fine. Can we start with you, Shane? Can you tell us a little bit about the kind of solutions that you provide for people with pre-existing medical conditions and how that's relevant in the current situation.
Okay, so well, we've got a digital care platform, so we can connect a coach, a trained healthcare professional. Normally, we're working with respiratory physiotherapists, so that we can give support in physiotherapy and active lifestyles for people. And that coach connects with their own control panel. They can see how the patient is doing in their own pre-existing condition. Could be COPD and so on. We've got some new instruments coming on which are very exciting. Intelligent health assistance in a key area of disease in the next month. And we're noticing a lot more interest from different countries in using the platform so that we can connect people cross-border. We can work with scientific clinical teams, and they can have their own space and run projects with additional technology, which they'd like to use in different environments. So right now, we're also going to work this week on a COVID care plan with some pulmonary rehabilitation experts. And it's a very exciting time for us because we know that people's safety is the most important thing now, and being accompanied and being guided by someone that you trust, but someone who has some good clinical knowledge is really important for people.
So I think that was one of the things that stood out. We were talking before in the interview was the fact that you have a human coach, as well as the digital aspect of it, artificial intelligence, which is used increasingly to provide advice and guidance to patients. But you have a human being at the end of the line. Yeah. So you see that as being a very important part of the digital therapeutics.
Actually, I think it's pretty much essential because I still feel that we're in this period of adapting people's behavior to using digital for their healthcare, social and healthcare. So that process needs some initial support before people become more versed in how they manage their online daily check routine, whatever their disease condition is, and so on, or using new digital devices, or understanding how this content is useful for them but meaningful to the clinical profession. Otherwise, how are we ever going to improve the doctor-patient dialogue? And that for us is essential from our organization to achieve a benefit for the key stakeholders, both key stakeholders.
Absolutely. Lucia, you're also working with a platform. Your rehabilitation platform provides support for people with pre-existing conditions. What kind of patients do you currently support with rehabilitation?
Currently, the version that we have is the neurology version. So we've been working with neurology teams as well as patients after a stroke or with MS, Parkinson's, or spinal cord injuries. And what we did was not only investigating how the physiotherapy as well as the cognitive stimulation of these patients is happening traditionally right now in several countries in Europe. We also translated all the classical approaches, so motor and cognitive, into games, digital interactive games. And we co-designed these games with these kind of patients, because for us, what is extremely relevant is to be able to motivate these patients, because we want to support adherence to the therapy, because normally once you discharge these patients from a clinic, they tend to forget, they're in pain, it's tedious, they don't see the point, and so on. So they don't train anymore. But with these kind of systems, you can prolong the therapy periods, which is absolutely important, as well as make the whole caring system scalable, so that a few therapists can take care of a lot of patients if they're motivated to train at home. And to address also a little bit the question that we had from the attendees before, what I've seen is an increasing interest in this period of these systems, because clearly now people tend to realize much more that we have to find ways to take care of patients, keeping them safe at home, while still being able to steer with human experts the therapy plan, because what you need is a highly personalized therapy plan for each single patient in each moment of the therapy. So this is what we're offering right now.
I think the idea of the personalization is very important, can I move on now to Leslie and shift a little bit away towards the kind of therapies that are used for mental health on patients who are not suffering from the virus but are affected by the lockdown and the social isolation measures.
Yeah.
So
So
Leslie, what got?
go ahead, David. I'm sorry.
Yeah. So you're also, like Lucia, you're also involved in the development and the use of games. So how do those kind of games work in a therapeutic sense?
So my company did have physical board games and card decks in many different for many different populations. So I pivoted very quickly and I launched COVID-19 CPR.com. It's a website. It has 7 games on there right now. Anybody can use them. They can get on Zoom, any kind of platform. They can get on the phone. They can use them at home with their family. So there's one with 100 questions, just the process. Everybody answers the same question about COVID. There's loss and remembrance for people who have lost people. They can play with anybody, even if they haven't lost, to help them. There's one for healthcare frontline workers. There's one for prison reentry. Keep it real, just to get to know each other better. Addictions recovery. We also just launched game nights. So there's recovery coaches leading addiction recovery game nights, prison reentry game nights. This is all at COVID-19CPR.com, free for anybody. So people are telling me it's saving their marriages. We're launching, we have 50 formerly incarcerated people forming online healing groups to just get, it's obviously we're fast tracking this as fast as we can because people are really falling through the cracks emotionally. So, everybody's talking about pivoting. This is what I'm working on building out now, is a way for the masses to come together to have much deeper conversations. You speak to your comfort level. You can go much deeper with this because you're just moving on to different questions, and everybody can share and be close to each other.
Yeah, that was the thing that struck me, is that a lot of what you do can help people to open up and communicate how they really feel about things, when in any kind of relationship, these things often get more difficult as time goes by.
People
So
don't
I'm going
know
to move
how
over
to.
now.
Go ahead, Dave.
No, they don't know. They don't know how to. So you're really acting as a kind of facilitator and broker to help to repair or to build those bridges between people. Okay, we'll move on to Todd now. What about virtual reality? I can see a beach scene helps you to relax and get a comfort zone. What about VR and its mental health benefits?
Yeah, I think there are many. So, this has been a fantastic conversation, and I love all the topics we're covering. So yeah, look, one of the big things is behavior change. And again, when we come back to the neuroscience, the way you change behavior is gradually and incrementally over, hundreds, if not thousands of repetitions. And when we're talking about mental health, resilience, dealing with stress and anxiety, what we need to do is, when we're feeling stressed, we're feeling anxious, we need to have that intervention. We need to have it. It needs to be consistent. That is, you take the best intervention you can develop that's, empirically driven, scientifically based, evidence-based, that's consistent. You apply it at that time. You scale it out to, as everybody on the planet if possible, and which is the way the world we live in now and are going to for a while. And it's available 24/7. And that's what virtual reality offers. You can take a VR headset with a set of evidence-based high quality content. You're feeling stressed or anxious, put on that headset, lower that anxiety level. One of the things I like about the offering at Applied VR, and just for the record, I've only been there a couple of months, so I didn't develop this stuff, but what I like is the emphasis on biopsychosocial approaches. So we're not into, for example, with pain management, opiates work, we know why they work, but there's all these side effects. And the fact is that you can deal with pain, you can deal with anxiety, you can deal with stress using psychological approaches. And I think, serious games, gaming, all these things we've been talking about here are really leveraging what's going on in the brain. But what I really like is that the approach has been very broad-based, not only helping you understand how your body works, educating modules on education around pain management, stress, anxiety, developing breathing techniques, implementing these breathing techniques that from a, whether you're cognitively thinking about it or not, are affecting your physiology and are reducing your stress level and your anxiety level. So the tools are incredibly effective, and they've been around forever, but usually in one-on-one, or here's a PDF, read this and follow these instructions. It's just not engaging. People are going to get bored doing it. Whereas if you can turn that into a game, or you can have a background like I have on my screen right now that is reducing my anxiety. It just is. I'm not thinking about it, but it is. That's going to be very effective. So, consistent, scalable, available 24/7. For me, those are the real keys to virtual reality. And I think, tons of opportunity now. So.
Yeah. Yeah. And I guess you don't necessarily need a VR headset to be able to do that. But increasingly, it's a sense of immersion. I think that's a key point. So, Jerry, I'm going to move on to you now. Have you got any thoughts on the impact of coronavirus on mental health in China? Has there been any difficulties that you've been aware of?
You mean the COVID-19 disease to the damage of the healthy person?
Yeah. Yes.
Okay. Actually, I have been focused myself on the patient treatment. I didn't think this question before. Actually, I think if we can control the disease in worldwide, maybe in our country, maybe the health person will feel better. If we cannot control the disease, they feel horrible, worry about himself, and so on. So the best I control I focus my work for the
as an oncologist, your work is focused on healing people and tackling the disease, and I guess there's bound to be some kind of psychological and mental health benefit if people feel confident that the virus is under control. So I'm now going to move on to, and I'll stay with you for this, if I may, Jerry. Looking at the impact of COVID-19 and the stress that it places on people who are in the medical sector. So in other words, clinicians and care workers. There must have been a lot of pressure on you and staff in hospitals in China whilst COVID-19 was rampant.
Okay, for our physician, the doctor and the nurse working in the fighting of COVID-19 disease, we always be numbers. I think I can tell it numbers, because we always face the patient with infectious disease. We always worry about ourselves. How to deal with it? Maybe we should listening to the radio, listening to music when we off duty, and we also have some expert in mental health. They will teach us some method to relax us.
Okay, well, I think we've got a great panel of experts here. So if any of their expertise is useful in China, then I hope that some of the connections that we can make through this event will prove valuable. I'm going to move on now to Lucia and ask her to give her thoughts on the effect on the pressures on the care workers and the clinicians during the crisis.
I think that's quite devastating, honestly. I've seen pictures and heard a couple of interviews, and I think these people are under tremendous stress. So there's really space for having some thoughts on how to support them. What I found most interesting and sweet also, you know how much I like animals, is that some hospitals have allowed dogs, special dogs, of course, like therapy dogs, to enter hospitals to support these people in their breaks. I've seen pictures of doctors and nurses lying on the floor in the hospital and hugging a dog. So there have been some attempts to support these people, but I think there's so much space for improvement here that we can really, well, unleash our creativity, I think.
Oh, absolutely. So I want you to unleash your creativity, Shane, for a second, and talk about some of the pressures on the care workers and the clinicians. How can we deal with that?
Okay, well, Spain is actually the worst infected country for the care workers. Inadequate equipment arriving, being ordered, being used. I don't think that we should be pointing the finger really at each other for this situation, because it isn't going to help. This was panic-driven decision-making, as you could say, through anxiety and stress, and perhaps not the best decisions have been made. I think they're incredibly resilient people, but I thought that for a long time before we even hit COVID. From the last recession, the reduction in resources in healthcare services were huge. And that wasn't just in countries with social public healthcare models. It's been across the world, really. So I think that I'm incredibly, I have great admiration for the healthcare professionals and their resilience. They need much better protection. That is clear, because we cannot lose our healthcare professionals if we're going to be confronted with waves of COVID-19 and we have to be prepared. Then they really do need much better support. One thing that distressed me, which was happening in some countries, is that some healthcare professionals, when they were returning from their work, they were getting publicly abused by people, because people, sadly to say, in their ignorance, are just sort of claiming, well, you're going to infect me, so I don't want you anywhere near me, which I think is a really tragic way of dealing with people who are working daily to save lives on shifts, which must be incredible. So yeah, I think that we need to support our healthcare workers as much as possible. Yeah,
I did actually intend to say right at the very beginning of this session that personally in the UK we owe a huge debt to people working in the care sector, because many of them are putting their lives at risk to support people whom they have no social connection with. They're not family, they're not friends. Okay, you could say it is their job to do that. But many of them knowingly put their health at risk in order to support other human beings, and I think we should applaud that. Have you got any comments, Todd, in this area on the care workers, etc.?
Yeah, I mean, just paint this picture. You go to work, you put on protective, personal protective equipment if you have it. You can't take a drink during the day. You can't go to the bathroom because you'd have to waste that PPE, and we don't have enough of it. You can't have any social contact with the patient. Death is rampant around you, people suffering, patients as well as their family members who are stressed out. After your 12-hour shift, you go home, you can't hug your kids, you can't hug your husband or wife. You're self-isolating. You go to sleep and you go do it again tomorrow. I mean, that's the life of a frontline hospital professional, over and over and over again. The stress, the anxiety. I mean, these are the folks with the highest level PTSD around. They are going to need help today with PPE. They certainly need psychological help. They're amazing individuals. My empathy for these folks is off the charts.
And Leslie, finally, your thoughts on this subject. Do you have any clients who are care workers or working in this sector?
No, I don't personally have any, but I was a Department of Defense reintegration specialist for 2 years. There's a lot of correlation between their lives being at risk, constantly being separated from families, having different experiences. So I think there's a lot we can draw on from the military community, what they put in place over the last decade around PTS and healing from that. And I'm hoping people might start thinking of putting into place some ways to help frontline workers deal with their PTS after this is all over. You can get through anything. It's afterwards it all starts coming out. So I think, we need to start thinking about that.
Well, that leads really nicely onto the final part, or one of the final parts of this webinar session, and to really ask all of the panelists what we can learn from the COVID-19 experience. I'm going to start with you, Jerry. What lessons can we learn from COVID-19 and its impact on people? I know you've had a lot of success with treating patients with COVID-19, and you've used digital medicine to help that. What other lessons can we learn from the experience?
Okay, at the beginning of this disease, we ignore it. We don't think it's will take a huge damage to us. So we should take more take more importance as that. So if we at the beginning we can control it seriously, maybe we can have a better life. Not only in China, but also in global. I think it's the truth. So that's the first lesson for us. The second, we should protect ourselves with some personal equipment, such as face mask, and wash our hands at any time. That's the most important thing for me. Okay.
Yeah, I think we've learned a lot of lessons about about the disease and how important it is to take these personal hygiene measures. So maybe our daily behaviors are going to be influenced by this experience of COVID-19. Shane, have you got any thoughts on this? What positive things can we draw from this?
Well, for us, from a respiratory based foundation, the most important thing is that all human beings respect their lung health. In a way, climate change was beginning to create an awareness that we hadn't seen 10 years ago in the importance of our lung health. Sadly, it's COVID that's going to reinforce that, how we breathe, how that helps us relax, as you said, Todd, how it helps us deal with anxiety, the air quality that we breathe. Yes, we've got good air quality now. Paradox as a paradox, really. So for us, that's key. Lung health is so vital to our overall well-being, and we want people to realize that.
And Lucia, what positive things would you draw from COVID-19 experience?
Well, David, I think that we all have very many lessons to learn from this, bad adventure, because every bad thing contains very positive seeds that we have to find and work on. On a business side, we see that we can put other plans and other strategies in place to support people in any kind of condition, so we don't need very many emergency plans if we're better equipped and better organized. But also on very many personal levels, I think that people are learning, and I'm also positive as Shane is. I think that very many people are taking lessons with them, such as being grateful for health and not taking it for granted. So having a look overall, not only lung health, I would say health in general. I think we also learn to be resilient in some ways. We also learn how to, how to distinguish what is important and what has some very good values. And sometimes we all run after things that actually don't mean anything. And also on another level, to be more organized, so that we, for example, avoid physical meetings when we can avoid them, to respect our planet, even to have more free time to take care of our families or beloved ones, to have a better quality of life. All these aspects also go into the direction of reducing anxiety and other problems. I think everything is related in a way.
Mm. Yeah, that's a good point. So I don't think we're going to go back to the old normal life. I think there's an opportunity to have a new kind of normal life. What would you say to that, Todd?
Yeah, I'd say good. That's exactly what we need. Look, the things that we can, and I hope we'll learn from this. I mean, one is hygiene, right? Washing your hands a lot is actually a good thing. And I know I haven't been very good at that, but I'm learning behavior change. Empathy and appreciation for others. We're a global community. It's not one country or one people against the other. If we want to make our country great, we make it by making the rest of the world great too. Plain and simple.
Yeah. A very philosophical answer, Todd. And Leslie, what are your thoughts in this area?
Yeah, so I think the greatest gift is that we are recognizing we're a global community and we all need each other. Also, I don't know if this is happening everywhere, but the entrenched inequities and disparities have really been highlighted and brought to the forefront, especially in the New York area. So I don't know if that's everywhere, but the frontline workers and the grocery store workers and all the people who have been basically ignored are really being appreciated, and we're recognizing our value systems are shifting for a lot of people, of course, not for everybody. So that's an ongoing process. We'll see where that all lands, but I think that's a very important shakeup. And so for me, that's one of the most important things.
Yeah, and I'm really grateful to our attendees. There's been a little bit of chat. There's been exchange of URLs and questions. Please, if you have any questions or you want any more information, you can type it in now. But I'd also encourage you to think about joining us tomorrow when we're going to have more of an open discussion and networking sessions, and other people who have solutions in this area will be joining the virtual conference tomorrow at 2:00 in the afternoon. What I'd like to do now, and maybe Todd, of all the people on this panel, may well appreciate this concept, is that one of the things that I miss about the lockdown and the social distancing things is the opportunity to travel. It's been a big part of my life over many years, and I've been very lucky to travel to a lot of different places in the world. So I know it's not quite the same as being there, but at least what I'm going to try to do is transport you to China, to Guizhou International Hospital, and to show you a little of the hospital and also a little presentation that Jerry made. Again, I do apologize if there are problems with the level of audio on this next sequence, but I've put in some subtitles to Jerry's video. So what you will see is going to the Guizhou International Hospital. You'll go into the lobby. You'll see Jerry do his video. And then for a couple of minutes, I will try and take you around and show you some parts of the hospital. And as it was during their launch event last October. So I'm going to start sharing the screen now and go over to China. And here you can see a picture of the hospital and also the opening ceremony, all the nurses there, some of the technology that's being used, and the president of the hospital, Professor Xiaoshang Zhang, and some robotic surgery technology that they use there. But now we will zoom in to outside the hospital, the outpatients department. And the way that I've set this up, there is a little bit of an introductory text, which explains what it is about. I'm going to skip that and go straight into the reception area, where you should now see this presentation from Professor Sun.
think about transformation technique to something useful because we need it often. First, we need some wireless medical equipment such as electronic temperature, remote monitoring equipment, portable ventilators, and portable echo machine. Second, it's wonderful if it can read CT images of COVID-19 disease automatically. We deem that artificial intelligence and deep learning can give you fun. Third, our team are building a neural network model to quantify the severity of COVID-19 disease. We have 4 kinds of parameters to set up the model, including generation information such as age, gender, smoking status, and so on. Blood detection information such as blood cell count, inflammation factors, oxygen, saturation, and so on. Also, we need the information on underlying disease and CT imaging data to add into the model. We try to predict the severity of COVID-19 disease by this model. What about what we saw recently? I believe we can contribute to state regardless someday. Hope all of us can fit. Thanks for attention. Take care. Bye-bye.
So that was Jerry's presentation, and I won't go into the opening conference, but what I will do is just maybe show you a little around the hospital a little bit. So all of these images were taken during the hospital launch, and all I've done really is to create them into a virtual tour, which does advance automatically. But you can see that the event was well attended. There's a lot of clinical staff there. This is the auditorium, and you can see the nurses and the doctors. And on the main screen, that was the opening ceremony. In the interest of time, I'm just going to let the virtual tour run, so you can see as much as the hospital as possible. So we go back to the opening conference, but you can, in this virtual tour environment, you can also go to different areas of the hospital. Radiology, I know, is something that is of interest to Professor Sun, because that's one of his areas of expertise, but this is an MRI scanner, and there's a little video which is from the Cancer Research UK, explaining to patients what to expect when they visit a hospital and have an MRI scan. So I just wanted to share that with you, just to give you an idea of what this new hospital looks like. It's a 3,000 bed hospital, and it was built in a period of about 2 years before it opened. So quite a remarkable achievement. So I don't think we have anything in the Q&A session. So I'm going to ask each of the panelists if they have any closing remarks, and just say thank you for your participation today. I look forward to the session tomorrow, where we will have an opportunity to meet with other experts and panelists and have more of a networking session. So I'm going to start with you, Todd, and then work up the page. So any closing remarks, Todd?
Sure, I'll just say physically distance, but get as connected socially as you can.
Absolutely, yes. It should be physical distancing, social get-togethers. Leslie.
I want to wish
spot.
everybody Safety. I want to thank you, David, for the honor of being on with these amazing people on the panel. Thank you all so very much. And, you know, hopefully we can all learn a lot more empathy and love and helping each other.
Thank you very much. And Jerry, you come all the way from China. Thank you very much for your participation. We run this event in Zoom primarily so that you could take part in the conference. Have you found it worthwhile?
Well, thanks for the invitation. I can learn from you and have a good communication with you. So I hope we can have more opportunity to talk with each other in future and hope you keep fit and defeat the virus someday.
Yeah, I say yes. I say amen to that. And so, Lucia, any closing remarks?
Well, I'm very sure that exciting times are waiting for us, at least digital-wise and technology-wise. And thank you very much for this amazing experience. It was great to see some of you again after so much time and getting to know the others, and stay healthy, everyone.
Thank you. And finally, last but not least, Shane.
Just to say thanks very much. It's been a privilege to connect with you all, and for David for inviting me to participate. And I think what we can show also is that we still care for each other, even through a digital environment. And that's very powerful. It's still powerful, even though we can't face to face. So I think we can change things for the future and overcome the real problems that we confront with our health, with COVID, and with our economy.
Thank you very much to all our panelists and all our participants. I hope you got real value from today. There will be a virtual networking conference session tomorrow in a different platform called Remo. I will be posting a reminder on LinkedIn and through other channels, and I would just ask you to share that and try and get as many people to join as possible. We do have at least 2 or 3 more new experts joining us in this virtual networking session tomorrow, and I'm sure they get real value from what we've done today, and also from sharing with their expertise with yours and any participants that we get. So thank you, one and all. I'm going to draw it to a close now. My address is david@davidwortley.com if anybody has any further questions. And I look forward to continuing to work with you in the future. It is a real privilege to me. I'm blessed that I have so many talented contacts from all around the world. And I'm very grateful to you for your sharing of your expertise. So thank you and stay safe and bye-bye. Bye-bye.
Stay safe.